Hello friends, welcome back to our YouTube channel Doctor's Corner. In this today's lecture, we are going to discuss one of the very important topic, coronary circulation. So what is the clinical significance of this particular topic we are going to discuss today? Myocardial infarction or simply heart attack, okay? So it's one of the leading cause of death worldwide. So the main cause of this is due to the disturbance of this coronary circulations. To understand this mechanism, we will study the physiology of coronary circulation today. So we will study this section under the following topics. That is functional anatomy. We are not going to discuss in detail about the anatomical aspect, only the functional anatomy of the coronary circulation. Then normal values of the coronary circulation. Also, we will discuss about the regulation, and before that salient features or the peculiarities of the coronary circulation, and finally the regulation. So under this following headings or with this objectives, we are going to discuss this today's topic of coronary circulation. Okay, so coming to the functional anatomy first. So what is coronary circulation? So coronary circulation is the circulation or the blood supply to the heart. As you will be knowing that heart supplies the blood to the different organs of our body like brain, kidney, liver. All the organs or the tissues of our body are supplied by the heart. That is, heart acts as a pump and it will supply the blood to different parts of our body. But heart itself will receive the blood. So the blood supply of the heart is mainly from this coronary arteries. Okay, if you can see this diagram. So mainly it is supplied by this right coronary artery and the left main coronary arteries. Okay, so both are the branches of the ascending aorta. So this right coronary artery, it arises from the anterior aortic sinus, and left coronary artery from the left aortic sinus. So this right coronary artery, it will traverse in between the right atrium and the right ventricle, that is the right atrioventricular groove. Okay, so after traversing this, then it will turn posteriorly. However, we are not going to discuss in detail about the various branches, but this is about the right coronary artery. Then the left main coronary artery is a small artery, just around 1 to 2 centimeter in length. So this will divide into two main branches. One is circumflex artery and left anterior descending artery. Okay, now this circumflex artery will traverse in between the left atrium and the left ventricle, whereas this left anterior descending artery will traverse in between the right ventricle and the left ventricle, that is the interventricular groove. Okay, now so this basically this three important blood vessels will supply the heart, that is the right coronary artery, left anterior descending artery, and the circumflex artery. Okay, now this is the arterial blood supply, and one of the peculiarity of this is this arteries will go from the epicardium to endocardium, that is the blood supply goes from outside to inside. So what is epicardium? You know, the heart has three layers. The outer layer is the pericardium, middle is the muscular layer, that is the myocardium, and inner layer is the endocardium, right? So this pericardium, which is the outer layer, it has two layers. One is outer fibrous layer and inner serous layer. So this inner serous layer is further divided into two layers, outer parietal and inner visceral layer. That inner visceral layer of the serous pericardium is known as epicardium. Okay, so this blood vessels, that is this coronary arteries, which supplies the blood mainly to the myocardial muscle. Okay, so that it will traverse from the epicardium, it will go to the myocardial muscle tissue towards the endocardium. Now the venous drainage. So after the metabolism and all, so the blood from the myocardium is ultimately drained into a 2 centimeter long vein, that is known as coronary sinus. Okay, so it has various tributaries. Again, we are not going to go in detail about the anatomical aspect, only the functional anatomy. So coronary sinus, and ultimately this coronary sinus drains into the right atrium. Okay, so I'll just draw a line diagram or a flow chart to understand the coronary circulation here. So first, how the blood goes to the heart. So mainly by the coronary arteries. Coronary arteries means this right and left main coronary arteries and its branches. So now this coronary arteries from the epicardium, it will traverse into the muscle, that is it will give various intramuscular branches, and finally it will divide into smaller blood vessels known as arterioles. Arterioles are the resistance vessels, okay, arterioles. These arterioles are further divided into the smaller blood vessels known as capillaries, okay, capillaries. So now exchange of the substances from the blood to the cell, okay, so it will take place across these capillaries. That's why these capillaries are known as the exchange vessels, okay. So generally the from the cell, oxygen from the blood, oxygen is taken up by the cells, and after the metabolism carbon dioxide is taken up by the capillaries. So the exchange of or other nutrient substances like glucose or other things will be taken, that exchange will be at the level of the capillaries. Then after that, the metabolism, after the metabolism of the cell, then the blood is drained into veins, so venous system. So it will drain into the small veins, then ultimately the larger veins, and ultimately from all the tributaries it will drain into the coronary sinus or anterior cardiac vein. Anterior cardiac vein, and this coronary sinus or the anterior cardiac vein will ultimately drain into the chambers of the heart, that is the heart chambers. Okay, so this is the general flow chart of the coronary circulation from the arterial blood and the venous blood. Apart from this, there are other blood vessels also. For example, from the capillaries bypassing this coronary sinus, there are other vessels which are known as Thebasian veins. So these Thebasian veins can directly open into the chambers of the heart, okay. Also we have other vessels like from the arterioles, that is known as arteriosinusoidal vessels. Arteriosinusoidal vessels that will directly drain into the heart chambers. Again, from the larger coronary arteries we have arterioluminal vessels. Arterioluminal vessels, okay, that will again drain into the heart chambers. Then there exists anastomosis. Actually these blood vessels, that is arteries, are end arteries, but whenever there is an obstruction and all, they develop into the functional anastomosis. So there is an anastomosis between the blood vessels of the coronary arteries or the extra coronary arteries or the non-coronary arteries. So the extra coronary blood vessels, extra coronary arteries, which further divided into arterioles. So this is known as extra cardiac anastomosis, that is the anastomosis exists in between the arterioles of the coronary arteries and the other arteries, neighboring arteries, okay. So this is the general layout plan of the coronary circulation. So now we have studied about the functional anatomy. Now coming to the normal value of the coronary blood flow. So heart will receive around 5% of the cardiac output. So you will be knowing that cardiac output is around 5 liters per minute. So the heart will pump around 5 liters of the blood per minute. So out of this 5 liters, 5% of this cardiac output reaches the heart, that is approximately around 250 ml. So the normal blood supply to the heart is 250 ml per minute. Okay, so this is the normal blood supply to the heart. Also, if we consider in 100 gram of the tissue, it will be around 70 ml per minute per 100 gram of the tissue, or 100 gram of the myocardium or 100 gram of the heart tissue. Okay, so this is the normal value. So generally it will take 5% of the cardiac output. Now we will deal about the peculiarities or the salient features of the coronary circulation. So this coronary circulation is very special because it is supplying the heart itself. So there are few of the peculiarities or the special features. One is you should know the blood flow. Then another one is the distribution of the blood flow varies. Distribution of the blood flow varies in various population groups. So what exactly it means is, for example, as we have discussed, the heart muscles, that is the myocardium, is supplied mainly by the different branches of either right or left coronary artery, but in around 50% of the population or 50% of the people, right coronary artery is dominant. Dominant here means major amount of the blood is supplied by this right coronary artery. In around 20% of the people, this left coronary artery is dominant, that is major amount of the blood is supplied by the branches of this left main coronary artery, and around 30% of the population both are dominant. Okay, so this will vary, that is the distribution of the blood flow varies in the individual and different groups of the population. Then the third and the most important peculiarity of this particular coronary circulation is it has high oxygen extraction capacity or capability, that is the high oxygen extraction from the blood. So as compared to the other tissues, this myocardial cells will extract more oxygen from the blood. So to make this point more clear, I'll just explain you. Consider this as a capillary. Okay, as I said you, the exchange of the substances from a cell and the blood vessel takes place at the level of the capillaries. Consider this as a myocardial cell or a heart cell. Okay, now this is a myocardial cell, this is a capillary. So capillary will have an arterial end, that is the arterioles. Arterioles will divide into capillaries, that is the arterial end, then venous end. Okay, and it has a venous end. So in between this there is a capillaries. So consider this as a capillary, it has an arterial end and venous end, and this is a heart muscle. So normally the arterial blood, it will contain how much oxygen? It will contain 19 ml per 100 ml of the blood, 19 ml of oxygen per 100 ml of the blood. So whenever 100 ml of the blood passes through these capillaries, it will carry how much? 19 ml of the oxygen, right? So this myocardial cell, out of this 19 ml which is passing through these capillaries, this myocardial cells will take around 13 ml of the oxygen out of that 19 ml. Okay, and the venous blood, in the venous blood it will be around 6 ml of the oxygen will be remaining, right? So it will be extracting how much out of 19 ml? If it extracts 13 ml, so arbitrary it is around 70 to 80% of the oxygen is extracted from the blood. So this is the case of the heart muscles or the myocardial tissue. Whereas if we consider the general other tissues or the other cells, okay, on this side, other tissues or the other cells, so there also the exchange of the substances or gases takes place at the level of the capillaries. So out of this 19 ml of the oxygen which is coming per 100 ml of the blood, they will extract only 5 ml of the oxygen. 5 ml of the oxygen, and remaining 14 ml of the oxygen will go to the venous end. That means they will extract only 25% of the total oxygen which is available in this arterial blood or the capillary blood. Okay, now so what does you infer? That it has a high oxygen extraction capacity. This is one of the very special features to the cardiac muscle, because it is extracting almost 80% of the available oxygen, so it is having very less reserve of the oxygen. Whenever there is a extra demand for the oxygen, then the available oxygen will be very less, because already it has extracted so much amount of the oxygen. Whereas for other tissues, if due to some pathology or disease or obstruction, if the blood flow is compromised, there is oxygen reserve is available, because they will extract only 25% of the oxygen from the tissues. That's why this myocardial ischemia or myocardial infarction or heart attacks are common for these myocardial tissues as compared to the other tissues. Okay, so this is one of the very peculiarity and the special features. It has the high oxygen extraction capacity, that is extraction of the oxygen from the coronary arteries at rest is high. Okay, this is one of the this one peculiarity. Now fourth important thing is coronary circulation will have a phasic blood flow. Okay, is phasic. So coronary blood flow is phasic in nature. Phasic blood flow. What do you mean by this phasic blood flow? So you know the heart will pump in two phases, systole and diastole. Okay, you might have studied in the cardiac cycle that heart, whenever it will contract, that phase is known as systole. Whenever it will relax, as it is known as diastole, right? Totally the duration is around 0.8 second. Out of that 0.8 seconds, approximately systole is 0.3 second and diastole is 0.5 second, right? So during the systole, the heart will pump the blood to the different tissues or organs of our body with a high pressure of around 120 millimeter of mercury, and during the diastole, the heart relaxes, the blood flow to the tissue is reduced with a reduced pressure, that is the diastolic blood pressure, which is around 80 millimeter of mercury, right? Now, so generally all other tissues will receive the maximum blood supply during the systole with a high pressure, right? But it is opposite in case of the myocardial tissue. Why? Because during this, as I said you, the coronary blood vessels will traverse from epicardium to endocardium. Consider this as a myocardial tissue, and this is a coronary vessel. So this coronary vessels enters from the epicardium to endocardium, and during the systole, when it is compressed, that tissue, that is this one, myocardial cells or the cardiac muscle cells, when it contracts, then it will squeezes this intramuscular arteries and the blood flow is reduced. Okay, and the blood flow is reduced because of this throttling effect or the mechanical effect by the compression of the cardiac muscle cells over the intramuscular arteries. Okay, so this is the reason why the blood supply is reduced during the systole, and whereas in diastole, when the heart relaxes, the blood supply is more. So we'll show this in the help of this diagram now. This is the left ventricular pressure, this is the aortic pressure. So generally during the systolic phase, this is the systolic phase, the left ventricular pressure is around 121 millimeter of mercury, 121 millimeter of mercury, and aortic pressure is around 120 millimeter of mercury. Okay, so during the systole, this is the left ventricular blood flow. So the blood flow to the left ventricles is reduced, you can see, right? Whereas during the diastole, literally the left ventricular pressure is nearly zero, whereas the aortic pressure, okay, pressure in the aorta is around 80 millimeter of mercury, 80 millimeter of mercury, and left ventricular pressure is typically zero. Okay, so the pressure gradient is so much. So during the diastole and especially the initial part of the diastole, the blood flow to the left ventricle is more. Okay, and again during the systole it is reduced, and during the diastole it will increase. Whereas in the right ventricle, since the pressure in the right ventricle is very less as compared to the left ventricle, so during the systole the pressure in the right ventricle is just 25 millimeter of mercury. So the such marked changes is not seen in the right ventricle, that is, but still overall the heart tissue will receive more blood during the diastole and less in the systole. Okay, so this is one of the peculiarity, that is, it receives the phasic blood flow. Okay, now then one of the another things we want to discuss is epicardial versus endocardial, the blood supply to the heart, that is the epicardial vessels, epicardial region versus endocardial region. So blood supply to the epicardial region and the endocardial region. Epicardial region means the outer part, okay, outer part of the heart muscle and the inner part. So as I said you, the blood vessels will traverse from the epicardium to the endocardium. So during the systole especially, the endocardial region are more prone for the ischemia. Ischemia means decreased blood supply. So the myocardial infarction or ischemia is more common in the endocardial or subendocardial region as compared to the epicardial region, because the blood supply gets compromised during the phase of systole. So they are more prone for MI subendocardial region because of this. However, normally it won't happen because there is certain regulatory mechanisms. There is a decreased diffusion distance between these, and the number of capillaries are more in the subendocardial region to avoid this disadvantage. But however, as compared to the epicardial region, subendocardial region are more prone for the ischemia because of this effect which I have already explained you. Okay, now then this coronary blood supply is closely related to the metabolism of heart, that is, coronary blood flow is closely coupled with the metabolism of the heart. So coronary circulation is closely coupled to cardiac metabolism. So what does it means? So if the metabolism of the heart increases due to any reason, for example during exercise, okay, so the heart muscles metabolism or the work is increased, so during the exercise, then the blood flow of the coronary to the coronary muscles or the coronary blood circulation is increased proportionately to the metabolism of the heart. So it will increase to 3 to 4 times. So generally normal it is around 250 ml per minute. So during the vigorous exercise and all, it can increase up to 3 to 4 times. So it can increase up to 1000 ml per minute instead of 250 ml per minute. So whenever there is increase in the demand by the myocardial cells, proportionately the blood flow is also increased. Why it increased or how it increased, we'll discuss in the regulation. Timing, just remember this, one of the salient features. Another salient feature is coronary blood vessels have collaterals or the anastomosis. Okay, so these are very important, collaterals or the anastomosis, especially whenever there is a obstruction to the major coronary blood vessels, then they develop the anastomotic channels in between the branches of the coronary vessels as well as the in between the extra cardiac branches, that is the branches of the other blood vessels other than the coronary blood vessels. So they will have a collateral circulation. So these are the peculiarities or the special features of the coronary circulation. Now finally we'll discuss about the regulation or the control of the blood supply to the heart, that is the regulation of coronary blood flow, that is the coronary circulation. Now who will control this blood supply to the heart? So mainly it is controlled by two important mechanisms. One is the local mechanisms or local control mechanism, and another one is the neural mechanism or neural control mechanism. Okay, so two mechanisms takes place for the control of the blood flow to the heart. So out of this, local control mechanism is very important. So locally your heart muscles has an ability to control its own blood flow by increasing or decreasing the resistance of the coronary blood vessels, which is known as auto-regulation. So auto-regulation, again, it is one of the feature or the special feature of the coronary coronary circulation. So auto-regulation means ability of an organ to adjust its own blood supply, okay, by increasing or decreasing the resistance of the blood vessels. So mainly this auto-regulation takes place with the help of the local metabolic changes which takes place. So whenever there is increased demand by the increased oxygen demand by a myocardial cell, the adenine nucleotides, especially the ATP, adenosine triphosphate and all, they are broken to ADP and further broken down to the adenosine monophosphate. Out of this, finally there is one product which is released, very important chemical substance or a product known as adenosine. Okay, this adenosine acts as a vasodilator. So in the heart tissue, this adenosine is produced. This adenosine goes outside the heart muscles and goes to the coronary circulation, and it will dilate the diameter of the blood vessels, that is the resistance blood vessels, to increase the blood supply to the heart muscle. Okay, so this is one of the theory proposed in the year 1963 by one of the scientists, German scientist known as Burns. So that's why it is known as Burns hypothesis. So according to this hypothesis, the heart muscle will control its own blood supply. That is, whenever there is increased metabolism of the heart, there is a release of this substance adenosine, which causes the vasodilation or vasodilatation of the coronary arterioles, resistance vessels, which will increases the blood supply to the heart muscle. Okay, so this is the local control mechanism. However, the other chemicals like nitrous oxide, also potassium, prostaglandins, H+ ions, so these also have some role, but the role of the adenosine has been proved by in various research, especially whenever there is a obstruction to the blood flow. Okay, this is the local control mechanism. Then neural control mechanism is mainly by the autonomic nerve supply to the heart, that is the sympathetic and parasympathetic nerve supply to the heart. So sympathetic supply to the heart and as well as the parasympathetic. So you will be knowing, so this sympathetic nerves will be acting on the heart tissue with the help of the sympathetic neurotransmitters like known as adrenergic or non-adrenergic neurotransmitters like epinephrine or norepinephrine, and which will act on the adrenergic receptors. Okay, so what are that, we'll discuss now. sympathetic and parasympathetic nerve supply. Okay, parasympathetic and sympathetic nerve supply. So first we'll discuss what is the direct action of this sympathetic nerve supply to the heart. So it will act on the alpha and beta receptors on the coronary blood vessels. Okay, blood vessels we'll discuss. So whenever these alpha receptors are usually present on the epicardial blood vessels, whereas these beta receptors are mainly present in the intramuscular blood vessels or endocardial blood vessels. Okay, extensively these receptors are situated there. So whenever if you stimulate this alpha receptors with the neurotransmitter like epinephrine, it will cause this vasoconstriction. So the direct effect of the sympathetic nerve supply is vasoconstriction. If there is a vasoconstriction, means decrease in the diameter of the lumen of the blood vessels. So if there is a vasoconstriction, definitely the blood supply to the tissue is reduced. So the direct effect is vasoconstriction, whereas when beta receptors are stimulated by the noradrenaline or norepinephrine, then what it will causes, it will causes vasodilatation. Okay, but overall effect is it will causes the vasoconstriction. Direct effect, it will causes vasoconstriction, but indirectly whenever there is a sympathetic stimulation, it will causes the vasodilation or vasodilatation of the coronary blood vessels. How? So indirectly, the sympathetic discharge will increases the heart rate as well as the contractility of the myocardial tissue, that is known as inotropic effect. Due to increase in the contractility and the heart rate, there is more cardiac output, and because of that more cardiac output, the vascular resistance is also decrease, which causes the vasodilation, and ultimately there is an increased blood flow to the coronary in the coronary vessels, that is the coronary arteries, and ultimately there is increased blood flow to the heart tissue whenever there is a sympathetic discharge. Okay, so this indirect effect is will override this direct effect of vasoconstriction. So overall, if you see, whenever there is a sympathetic stimulation, it will cause vasodilatation rather than the vasoconstriction. Then parasympathetic supply, again direct effect, usually it will causes the vasodilation on the coronary blood vessels. However, the nerve supply, parasympathetic nerve supply is sparse, that is, it is not extensively supplied as compared to the sympathetic nerve supply. So it is very minimal effect directly. So again, indirectly it will have the opposite effect. So it will reduces the heart rate, and it will reduces the inotropic effect. So ultimately it will reduces the blood flow to the heart. Okay, so indirect effect is opposite to the direct effect, and indirect effects are more pronounced as compared to the direct effects of this nerve supplies. So let me summarize what we have discussed today. We have discussed about the coronary circulation under these following headings. So we have discussed about the functional anatomy. Mainly the coronary blood vessels are the right and left coronary artery. Left coronary artery is divided into circumflex and left anterior descending artery, and the venous drainage is mainly by the on the posterior aspect. There is a coronary sinus which will drain the blood into the heart, directly into the chambers of the heart. It is the right atrium. So we have discussed the general flow or the general coronary circulation. Then we have discussed the peculiarities of the coronary blood flow. In that we have discussed first the normal value, then the various distribution of the blood flow, then most importantly high oxygen extraction by the myocardial tissues, then the phasic nature of the blood flow, and the epicardial versus subendocardial region, and the coronary circulation is closely coupled to the cardiac metabolism, and finally there are collaterals in the coronary blood supply. Then we have discussed about the local and the neural mechanisms of the regulation or control of the coronary blood flow. So this is all about the coronary circulation. We'll discuss about the applied aspect, that is the coronary artery disease or myocardial infarction, in the next or the other video. So stay tuned with us. Please subscribe our channel Doctor's Corner. Take care. Thank you.